Hello, my name is Bob Schrupp and I'm a physical therapist. Today I'd like to talk about some of the self-massage tools. And these actually are quite helpful for things such as general muscle soreness and fibromyalgia. And I like to keep one around the house. I just keep it hanging over near my workout area actually. And when I'm having some soreness, I go ahead and use it. And I'll go over that in just a minute. There are quite a few different tools out there that you can use, and I'm just going to name some of them. There's the Backnobber tube, which is by the Pressure Positive company. There's the Body Back Buddy, and this is the Theracane massager. And they're all very similar, in forms. They all have different knobs that you could use to help put pressure on the various parts of the muscles. So we'll go over that right now. Okay, when you're going to use one of these self-massage tools, generally what you're trying to do is you're trying to look for trigger points. And trigger point is just a sore spot in the muscle. And you're going to try to relieve the pain of that trigger point. So you're going to put pressure right on it. And quite often what we find is if you put, let's say there's a trigger point right here, if you put direct pressure on there and what they recommend is 8 to 20 seconds, sometimes it takes that long. When you put the direct pressure, often you'll find that point or that area of soreness will actually dissipate or be alleviated. So a couple other things to keep in mind when you're going to do this. When you're putting the pressure on there, on a pain scale of 0 to 10, I wouldn't go above a 5 or a 6. I don't want you killing yourself here or increasing the pain. The muscle should be somewhat relaxed, with the exception of one technique that we're going to go over where we actually have the muscles moving. The other thing is you want to stay away from arteries, veins, and nerves. I mean, you don't want to be doing it on the carotid artery here. You don't want to be doing it on your throat. You don't want to be doing it up in your armpit here. There's a lot of nerves, artery, and veins. Back of the knee. There's some commonplace areas that I think you would want to avoid. You want to begin to apply it, and everybody's laughing about this. You want to begin to apply it and slowly and gradually increase the pressure. I'm going to have Brad come in right now. Brad, do you want to introduce yourself?
Yeah. I'm Brad Heineck, physical therapist, and we're going to help Bob out. I was just reading a book on how to treat your own neck, so that fits right in with us.
There you go. He's always reading. Okay. So Brad, if you want to first maybe just turn this way. There's a lot of trigger points, and if you look for, if you're really interested in it, there are actually charts on the internet that you can find that actually show where the various trigger points are. But in your case, all I would do is, find the sore areas. And why don't you find a sore area, Brad, that you normally might bother you?
The one I normally treat myself with is this one up here, or there's another one right back in here where I get to.
And that's real common.
Yeah, you can find it. It's not a thing you have to be trained on. You'll know when you get over it. You just poke around and eventually you say, right there, I can feel it right there.
So the traditional way of treating that trigger point would, again, you find the spot, you gently start to apply the pressure and you increase the pressure. You don't go above a 5 or a 6 on the pain scale, and eventually hopefully it releases. Now the way I've used this is actually, it's almost a variation of a technique by Mulligan. He's a physical therapist out of New Zealand, and he does what are called mobilizations with movement. So what I like the way to use this is I actually apply the pressure, and then I actually do some movement with it, maybe some rotations, or maybe even some neck movement. And I just find that I get more relief that way. So it's just another variation of how you might use it. Yeah, there you go. That to me is a great way to apply it.
Yeah, it feels good. I use these a lot with patients as well, because it's a self-treatment. It's something they can do on their own. You don't have to have someone else do it to you.
And this is one that I think there are certain diagnoses that it works well with, and one is fibromyalgia. I've definitely had a couple of fibromyalgia patients who've had fibromyalgia that went ahead and bought one of these canes to go ahead and help self-treat. We'll go ahead and in the next section here, we'll talk about some, if you don't want to buy a cane, maybe some home remedies you can do.
Where do you get these?
You can get these, I would look on the internet, and I gave the names of the companies earlier on,
Just,
so.
just go online and you can order them right online like so many things nowadays.
Yeah, that's right.
Right.
All right, Lindsay, the camera woman, mentioned that I might not have let people know what the pain scale is. Generally, the pain scale, what we use when we're talking about that, is from 0 to 10. 0 means that you're having no pain, and 10 means that you're having pain so bad that you might have to go to the emergency room. So it's about as high as pain can get. So when we were telling you to apply the pressure on the trigger points of 5 to 6, you know, you're somewhere in that little bit above average pain range. And it's a subjective thing, there's no right or wrong, but just